You put a 2-year-old child in a crib with a bunny rabbit and an apple? Let me know when the child eats the bunny rabbit and plays with the apple.
Welcome to the Cannabis Vegan. I'm Jason Logan. On today's show, we're really going to be diving a bit deeper into the 2016 Cannabis Health Summit, where we'll be hearing a bit from Martin Lee from Project CBD as we look at a deeper aspect of cannabidiol. This and more from the Cannabis Vegan.
But I notice you have clothes on, and I notice that you have a cell phone and you have a computer. It is unfair to pick one thing that lions do that you want to mimic when you don't want to mimic anything else they do. When lions walk up and greet each other, they sniff each other's ass. When I came in this room, you did not kneel down and sniff my ass.
CBD has changed the national conversation about cannabis. I mean, it used to be the questions that dominated public discussion would be, is there anything real about medical marijuana? Does it really work, or is it just an excuse for people getting high? Is it just a front for stoners? Or the discussion tend to bog down about the dangers or the perceived dangers for children. And yet nowadays, the question isn't how many brain cells will be destroyed if my child is exposed to cannabis. It's how can I get cannabis oil to save my child's life. The question isn't does medical marijuana really work. The question is how best to use it for maximum therapeutic benefit. So let's talk a little bit about some of the basics. The molecular structure of CBD was elucidated in 1963 by Raphael Mechoulam, a young Israeli scientist, and a year later, his team at the Hebrew University in Jerusalem elucidated the molecular structure of THC. And they're fairly similar, the molecules. And they realized that both CBD and THC were biologically active, but that CBD was not psychoactive in the way that THC is. Well, more than that, actually, CBD can lessen or neutralize the psychoactivity of a THC, depending on how much of each compound is in a given strain or product. For most of the strains that are out there today, most of the cannabis strains have very little THC. They are little CBD. They are THC dominant. But increasingly now, people are seeking out CBD-rich products. We use the phrase CBD-rich rather than high CBD to kind of break the connotation between getting high. But I think that there's clearly a tremendous therapeutic potential with respect to CBD. That's evident from the anecdotal reports we get from many people using CBD-rich remedies for a wide range of conditions, sometimes near miraculous outcomes they're reporting. And at the same time, the experience of many medical marijuana patients are validated, powerfully validated, by the extensive scientific research that's gone on focusing on CBD. But that scientific research has been, for the most part, preclinical science, meaning research involving test tubes, petri dishes, animal studies, maybe human cell lines, but not actually clinical studies. So we're kind of in an odd situation where we have the scientists can actually tell us to a large degree how CBD actually works in the brain and the body, how it confers therapeutic effects. We have patients claiming that it does wonderful things for them, but the clinical research to prove that it works is largely lacking. And why? Because of cannabis prohibition. And one of the great tragedies, one of the many tragedies of cannabis prohibition is the impeding of medical research, the impeding of medical advances. So what does the science tell us about CBD? Well, I'm going to go through a series of slides and just look at some abstracts, just read the titles. I'm going to move through this very quickly. This is from a study in Brazil from 2011. which established that chronic use and high doses of CBD are well tolerated in humans. Note that this study wasn't seeking to establish efficacy, just simply safety and side effect profile. So keep that in mind as we move through these slides. And I'm going to do this very quickly to demonstrate what the preclinical research has shown about CBD. It's shown that CBD has analgesic properties, pain-killing properties. And this is a study that I'll just read the headline of the abstract. That non-psychoactive cannabis constituent, CBD, is an orally effective therapeutic agent in chronic inflammatory and neuropathic pain. This is an experiment done on rats. Next, CBD is an anticonvulsant. This is something we know from the dramatic stories of the efficacy in some cases of pediatric epilepsy and also for adult epilepsy, that CBD can confer very significant therapeutic effects. So this study states simply CBD exerts anticonvulsant effects in animal models of temporal lobe and partial seizures. Scientists create animal models of diseases to study those diseases. Next, CBD's anti-tumoral effects. This has been referred to in previous talks in this seminar. And this is from the California Pacific Medical Center in San Francisco. The abstract, the title reads, Pathways Mediating the Effects of CBD on the Reduction of Breast Cancer Cell Proliferation, Invasion, and Metastasis. And here we have an image from California Pacific Medical Center. On the left, you see the shot of the blotches. That's the breast cancer cells. This is human cell lines that are being experimented with. That's before CBD has administered. On the right, you see afterwards the breast cancer cells become less viable and die. Moving along quickly, from the same institution, CBD enhances the inhibitory effects of THC on human glioblastoma and cell proliferation and survival. And that's very important because it talks about CBD acting in concert with THC. Very important to keep in mind. They actually they looked at the effects of CBD on the brain cancer cells, had an anti-tumoral effect, also THC, anti-tumoral effect, but when combined, it was most potent in that context. CBD and diabetes. And I'm going through this to illustrate the breadth of conditions that CBD shows potential promise for. So this is from a study in Israel. CBD lowers incidence of diabetes in the non-obese diabetic mice. CBD as an antipsychotic. The headline reads, CBD, a cannabis sativa constituent, as an antipsychotic drug. And there's actually been some clinical research in this area. There's a study ongoing now at Yale University using single molecule CBD on testing its ability to help patients dealing with psychosis. CBD is an antibacterial agent. This is actually from the publication from the American Chemical Society. And this is an area that's somewhat neglected, I think, even within the medical marijuana community, that several cannabinoids, not just CBD, have very potent antibacterial properties. And from this particular study, they reported that CBD was effective in terms of dealing with MRSA. This is the antibiotic-resistant bacteria that kills like 20,000 people a year in the United States. It's been identified by the World Health Organization as one of the looming health crises of the 21st century. The fact that we've overused in medicine antibiotics, so that these, it's very clever that the bacteria finds a way to respond. But with CBD and some of the other cannabinoids, it hits them really hard. CBD suppresses irregular heartbeat. I'll just read this abstract title from the British Journal of Pharmacology. We're talking about now, this is blue chip medical journals here, science journals. Acute administration of CBD in vivo suppresses ischemia-induced cardiac arrhythmias and reduces infarct size when given at reperfusion. In English, what that really means is that when you give CBD to a live animal and you induce a stroke in that animal, after a stroke, the heart goes crazy and you have an irregular heartbeat, but the CBD suppresses the irregular heartbeat and normalizes and actually reduces the impact of the stroke, limits the size of the stroke, limits the scope of the damage. This is from the famous so-called patent based on study on research actually sponsored by the U.S. government. And this has been actually misrepresented as something pertaining specifically to CBD, when it was actually work done on both CBD and THC as antioxidants. And from the patent, I read now, cannabinoids, both CBD and THC, have been found to have antioxidant properties and are found to have particular application as neuroprotectants, for example, in limiting neurological damage following ischemic insults, such as stroke and trauma, or in the treatment of neurodegenerative diseases, such as Alzheimer's, Parkinson's disease, and HIV dementia. And that's what the U.S. government, at least one part of it, is recognizing about THC and CBD, that have these very powerful neuroprotectant and antioxidant properties. This is one of the most intriguing. This is from a French study published in the Journal of Neuroscience in 2007. The title reads, Non-Psychoactive CBD Prevents Prion Accumulation and Protects Neurons Against Prion Toxicity. Prion that's mad cow disease. That's an infectious neurological disease. Alzheimer's, you can't give it to somebody, but mad cow can be transferred from one mammal to another. And in this study, they concluded that CBD was effective, again, in a petri dish, to stopping the the prion disease at every stage of its development. Then I want to now shift from talking about CBD as a molecule to talking about CBD-rich cannabis as a plant. And there's really crucial differences here. The examples that I just read through, we could have chosen 20 other conditions. On this Project CBD website, we have 50 conditions, and we all documented by the science, that the preclinical research, largely, that's been done in all these different areas. But most of this research involves single molecule CBD, not whole plant CBD. And you can't assume because something is functioning in a certain way with an animal that it can be transferred, that experience, to a person. In fact, sometimes the scientists are getting different information from a mouse to a rat, no less from a rat to a person. And then you have some issues with gender. They're finding that it was amazing at the last International Cannabinoid Research Conference. There was a lot of reporting on the gender differences and how they're always using male rats in the studies and drawing inferences of it. And they're finding actually male and female rats respond differently when exposed to medications. So single molecule CBD is not the same as whole plant CBD. I mean, for start, how do I want to put it? The single molecule CBD is a very lonely molecule. It's a sad molecule. It misses its soulmate, which is THC. CBD and THC are the power couple of cannabis therapeutics. They belong together. They work best together. And that's been demonstrated or discussed in many of the talks that have been given in this seminar series. So, and it's important to keep in mind, it's not just CBD and THC. As others have pointed out, there are many cannabinoids. There's many other components of the plant, the terpenes, the essential oils that give it its smell, the flavonoids. All these different components have particular medicinal properties. But the magic is when they're combined, they create what scientists refer to as an ensemble effect or entourage effect, whereby the therapeutic impact of the whole plant is greater than the sum of the parts. And that's very important to keep in mind. So how does actually single molecule CBD compare to whole plant CBD? Well, there was a very interesting study done last year. It was published in a journal. The work was done in Israel. And one of the scientists, I should point out, was a preeminent figure in the field, Lumir Hanous, who was one of the discoverers of anandamide, the first endocannabinoid, the first endogenous cannabinoid that was discovered back in 1992. He was involved in that research, so he's no small fry in this. So what they did in the Israeli study, just to sum it up, they compared the essential oil from a particular strain called, cannabis strain called Avideco. And it's the Israeli name for what we call ACDC. It's the same strain. They both came from Spain. And they looked at how the essential oil from Avideco, or ACDC, compared to single molecule CBD in an animal study. And they looked at certain markers of inflammation and pain and so forth. And they and what they found was, in terms of the single molecule approach, what was required to get an optimal effect was a very high dose and a very specific dose. And if you miss that very specific dose, if you miss that narrow window by going a little bit too far